Welcome to my world, the world of the medical laboratory scientist. Health is wealth, knowledge is power. Today's topic has to do with dysglycemic cramp and hazard ratio. The hazard ratio of diabetes is a serious concern because once you have diabetes, you have you can experience so many complications, so many other problems. But the problem with this is if you are able to discover diabetics very early, you can avoid majority of these other complications. And that's why the science that could bring about diabetes, that makes somebody diabetic, it's what is my major concern in this video. Dysglycemia is a serious problem, that is something that has to do with the sugar level going up, that is hyperglycemia, or going down, lower, hypoglycemia. So when people experience these changes from time to time, it is at times a sign that the person could be diabetic. Then there are other signs that you see that could be pinpointing the symptom of cramps. When you feel cramps, though cramp may not be limited to diabetic cramps, but it is one of the symptoms that one should be very wary of. So this effort of mine today is geared towards early detection of diabetics using these dysglycemia and cramps, muscle cramps, as a pointer for early detection. So if you like my presentation, press on the like button, subscribe, and let us go into the slide section where I shall expose the cramp, the different muscle cramp causes, as well as dysglycemia and the hazard ratio. Outline: objective, introduction, complications, explanation, lab diagnosis, prevention, and recommendations are all that I shall be talking about. The objective: to create the necessary awareness of pre-diabetes symptoms and the necessary medical laboratory investigations to confirm the onset of diabetes mellitus before the establishment of the complications. Introduction: dysglycemia is a term used for an abnormality in blood sugar stability. This can include hypoglycemia or hyperglycemia. Insulin plays a great role in both conditions because when too much glucose is in the blood, insulin causes the various cells to absorb the glucose, thereby causing hypoglycemia. It is therefore logical to say that you cause metabolic disorder. Let us use this diagram to explain what I just said. You will see the colors. For insulin is a pink, while glucose is green. Looking at the optimal level, that's the level the glucose must not pass. So insulin at first will be normal. At that level, the glucose will be normal. But when the glucose continue to increase, insulin will go higher so that it maintains it at the normal level. It will compensate it, more or less. So you now have a situation where the glucose is rising up every time you are overeating a little. The insulin rises up to a greater level to bring it down so that all the cells of the body will absorb it. Now, this glucose is still going up. So when you continue to overstress insulin, the insulin will continue to rise up and it will reach a stage where the syndrome X is another name for metabolic syndrome, which is a cluster of conditions that increase the risk of heart disease, stroke, and type 2 diabetes. It at this level that you now start having these characteristics of high blood pressure. The person shows high blood pressure, high blood sugar level, abdominal cholesterol level, and abdominal obesity. This stage, once passed, it is just you have become diabetic. Then the insulin, you can see it getting shorter. The diabetes, the glucose is getting higher, which means that the insulin is not being produced by the pancreas anymore, because there is insulin resistance, and the pancreas has over exhausted itself. So there is a feedback on the pancreas, and the pancreas is no longer, because the cells of the body are now resistant, and the pancreas is no longer producing enough insulin, which can even work on the cells, because the cells no longer listen or accept the instruction of insulin. Yes, the final stage is that insulin no longer has any effect on the body. Glucose level rise, and you are diagnosed with type 2 diabetes. In time, the pancreas cannot keep up with the demands for insulin, and production decreases. So it leads on to the type 1 diabetes, where you have to now be given supplementary insulin from outside, injected with insulin. Insulin resistance can cause high blood pressure, high cholesterol, high triglyceride, high low density lipoprotein, low HDL, that's the good cholesterol, heart disease, depression, inflammation, pain, obesity, polycystic ovary syndrome, thyroid problem, hormonal imbalances, to name a few. If you would like to know more about dysglycemia, you can read more on your own. Now to explanation for this glycemic muscle cramp. Glucose is used up when muscle contract or relax, which also affects the electrolytes. The electrolytes are always the ones that pump in or pump out, especially calcium. Calcium is used for the muscles to contract, and you also need vitamin D for the calcium to be soluble and acceptable. So the electrolyte balance, as they all require the energy from glucose breakdown. The source of energy in the body is mainly breaking down of glucose through the TCA cycle, as well as the electron change. Then what happens once there is no energy? The cramps occurs as a result of hypoglycemia, because the muscles are starved of glucose. However, when glucose blood levels are high, excess glucose is excreted along with water and other salts, which result in reduced amount of electrolytes. The scientific explanation for the complications that we face, or people face with diabetes or dysglycemia, is gotten from the research on hazard ratio. The hazard ratio of diabetes. Diabetic has been linked to increased risk of death from various causes, including cardiovascular disease, cancer, and even non-vascular disease. The hazard ratio of diabetes, in terms of mortality, generally indicates an increased risk of deaths compared to individuals without diabetes. So when you compare people who have diabetes with those who don't have, it is experience that they have increased the number of deaths, the increased ratio of deaths. A hazard ratio greater than 1 indicates that the event, death, is more likely to occur in the group with diabetes compared to the group without diabetes. A ratio of 1.8, for that instance, saying 80% more likely to die from diabetes. So far, they have found out that 1.80 for death from any cause, and 2.32 for death from vascular causes in patients with diabetes. This ratio suggests that diabetes increases the likelihood of death from various causes, particularly those related to cardiovascular health. Further explanation on cramp. Muscle cramping is relatively common in people with diabetes mellitus, although research from Hans Osteg suggests they do not appear to be more prevalent in people with type 1 diabetes. Diabetic neuropathy. High blood sugar level over time can damage the nerves, including those that control muscle function, leading to cramps. So you can expect those areas later to be dead to feelings. You don't even feel anything there. Peripheral artery diseases reduce blood flow to the leg and feet, can lead to oxygen deprivation and muscle cramping. Increased glucose level in the blood often obstruct the flow of oxygenated blood to the nerves of the feet, resulting in intense leg pain and cramp. This may lead to nerve damage and amputation when diabetes patients neglect the leg cramp symptoms of diabetes. Now to lab diagnosis. Dr. Jean Jill, a medical lab scientist who happens to be a specialist and also a member of the African Society for Laboratory Medicine, disclosed that glycemia manifests in 3 progressive stages. Impaired fasting glucose, the range is listed there. Once it's above that level, that is impaired. Impaired glucose tolerance and over diabetes mellitus. That one is when it is very obvious. The glycosylated hemoglobin would be greater than 6. He opined that to catch up this metabolic derailment very early, it is necessary for us to use other tools, not only the fasting glucose and the glycosylated hemoglobin test. Other screening tests that could be done are the C-peptide test. It protects against hypoglycemia, memory, and vascular endothelial cells apoptosis. So it's a very useful test. Glucagon could also be done. These are normal values. Glycoprotein, fructosamine, insulin test, normal value to know whether C-peptide, I've mentioned it, the values are there. Phospholipids, pyruvic acid, all these screening tests are for diabetes. Electrolyte tests for calcium, magnesium, and potassium in case of where you want to really know whether the cause of the cramp is more of diabetes cramp or other reasons. There are so many reasons that I have that is also shown above. You can see all those here listed above. Stress, fatigue, dehydration, not stretching, engagement. Finally, recommendations. One of the most important tests for early detection of diabetes mellitus is the glycosylated hemoglobin HbA1c, and it helps gives the average level of glucose maintained in the blood, circulating blood for at least 3 months. So that way, one can be rest assured that there is no impairment in glucose level. It is important, if diabetes is familiar, that one should regularly do this screening test and avoid overeating without exercising the body. There are other signs and symptoms apart from the cramp and tingling of fingers. The extreme extremities, especially the leg, the calf, are areas of this cramp that one must take note of. There is unusual thirst and feeling hungry too. It's a symptom of diabetes. Urinating once you have passed the threshold, just unnecessary urinating. Carbohydrates are very addictive, so avoid overindulgence. You can understand when you have hyperglycemia, you urinate more, and so you are going to pass out more of these electrolytes, and you are going to experience cramp. The body mass index is a very indicative index. Waist circumference and the neck circumference are indicative of somebody being prone to diabetes. So when your measurement is, you are able to maintain it at the level that would assure you of a healthy lifestyle, because the more you overindulge yourself in things that will increase the calorie intake, there will be metabolic disorder, the syndrome X that was highlighted in the chart that I showed you earlier. But where these things have gone haywire, then you need to consult your doctor, your physician, for full treatment. And this is the 176th video, so you can watch more. If you like my presentation, just click subscribe.